Taylor, how are you doing today?
I'm good. How are you?
I'm good. Listen, today we want to talk a little bit about the diagnosis of schizophrenia.
Of course.
And talk about how we advocate for our clients and kind of what that diagnosis looks like for people and maybe what we do at our agency to help people.
Yeah. I think a big part of our agency is working with people diagnosed with schizophrenia or somewhere along the schizophrenic spectrum, whether that's schizophrenia or something else called schizoaffective disorder, which we'll probably get into later. I think a lot of people think schizophrenia sounds like an intimidating diagnosis, something that's labeled as crazy in the society, and that has a lot of stigma surrounded around it, along with other diagnoses of mental health.
And so really what we want to do at our agency is really talking people first language.
Yeah.
And sort of talking, instead of about a disorder, maybe a person first that might have a diagnosis of major depression, schizophrenia, just like we would maybe with a person that has diabetes or something of that nature.
Right. It's not, your diagnosis isn't a label.
Right.
It's something you're just dealing with or you're managing. So instead of saying, he's a schizophrenic, a paranoid schizophrenic or something like that, instead be like, this is John. Or it would be like saying, hi, my name is John, and I have schizophrenia.
Right.
It's something that you have. But it doesn't embellish, it doesn't make that who you are,
Right. Absolutely.
And so I think a lot of people don't know maybe the symptoms of schizophrenia, and so I think we can talk about that a little bit too.
I actually think it's maybe one of the most misunderstood diagnoses, and of course, as with anything, and with anyone that we're working with, symptoms are different for every person,
right.
And so we want to make sure that all of that's individualized,
yeah.
Even though from a diagnostic standpoint, it's important that we have to categorize diagnoses. So there is a difference for that. So what are some of the symptoms that a person with schizophrenia might experience?
Yeah. Well, there's two kind of labels of symptoms of schizophrenia. There is positive symptoms, which is stuff like visual, auditory hallucinations, so seeing, hearing things that aren't really there. Some people deal with tactile hallucinations, which is like feelings that aren't really there, where something's maybe it could be crawling on them, it could be a burning sensation. I've heard a lot of different stories about that. There's also olfactory hallucinations, which are smelling things that aren't really there. And then you also have something called delusions, which is another positive symptom. So delusions are usually really rigid beliefs that have like no logical place in the conversation or in their thoughts. So that could be someone thinking that they own a business, or that there's some superhero or something like that, but in reality that's not true. But to them, it is very true. It's a very true thing that usually goes away on its own. A lot of times it's hard for that to kind of break those delusions.
So when you're having conversations with people that might have a diagnosis of schizophrenia, do you try to talk them out of those beliefs that they have, or ignore? How do you approach that?
It's not so much sometimes talking them out of it. A lot of times, a lot of our people that are diagnosed, they're taking medications, they're managing it, and even medications sometimes don't break those delusions. It's just something that they kind of have to deal with on their own, and one day, a lot of times, it just kind of goes away entirely. Now, medications certainly do reduce delusions and paranoia, but a lot of times I kind of try to not focus on the delusions and focus on other aspects of their life that they can improve on. So how are they coping with voices that they still hear? How are they coping with the paranoia that they may be feeling from their diagnosis? And so that, in that turn, kind of allows for recovery to always happen, and not to focus on something that may or may not be fixed from delusion,
Do you think, or are you working with people that maintain their relationships, work out in the community that have a diagnosis of schizophrenia? Is that something that can be managed?
Absolutely. I mean, a lot of people think, and I think it's society standards too, and the stigma behind it is that these people are unworkable, that they can't, they're not able to be productive members of society. And that's why a lot of times they end up in jail. A lot of times prisons, jails are a dumping ground for people with severe mental illnesses such as schizophrenia. But it's totally possible for them to work, and as a provider, it's our job too to empower these people to build resiliency skills for them, to learn that they can work, that they can manage this, and that they can really get back to that quality of life that they want or they may already have.
And so really it's to a standpoint when people do come in for treatment,
Mm-hmm.
may notice that things are not going as well as what they would think in terms of their mental health.
Mm-hmm.
Maybe they're seeing things that aren't real, hearing things that aren't real. So they may come into our agency for an intake and hopefully an appointment with one of our psychiatrists or prescribers to see if there's some medication that might be helpful in managing those.
Mm-hmm. Medication is probably one of the best, ways to reduce symptoms for schizophrenia. If you look at research that's out there right now that's peer-reviewed from empirical studies, medication and its effectiveness for schizophrenia has the most research out there compared to other severe mental illnesses such as bipolar disorder, major depressive disorder. And so that really tells a story that, hey, antipsychotics, they do work. They do work. It may take some trial and error to find the right one for you. But, I mean, as far as research goes that's out there, there's the most on it. So most people know about the pills as a medication and pill form, but a lot of the time people don't know there's an injectable form of antipsychotics. So would you explain that a little bit?
Well, I know that the prescribers at our agency, and again, we're not medical professionals, and we're not, picking one thing over another or suggesting that. But sometimes that might work for a person rather than taking pills every day, medications every day, to be on a longer lasting injectable medication. And, there's new medications that come out all the time. But some injections are every couple of weeks, some are monthly, and we have a newer one that is, I think, every 3 months.
Yeah.
So for some people, that's a much better option to help them manage their symptoms over the long term, rather than having to remember or be reminded of taking medication every day.
Yeah, and possibly at risk for something called decompensation, which is where people kind of get an increase of symptoms, especially leading to psychosis. So injectable forms of medication seem like they do have a really big impact on somebody's recovery, especially if they do have a hard time taking medications on a daily basis.
Absolutely. And so we also at our agency, not just medication, it's usually medication in conjunction with working with the case manager, talking about skills training, and that's something that's learning how to manage symptoms, learning new skills for coping when things are not going well.
Yeah.
And in those times that we're not working directly with people, because we can't work with people 24/7, but we want people to have some skills in their toolbox to be able to use and practice on their own time.
Absolutely.
And kind of helping them along the way with those.
Yeah. Coping skills, I mean, it's medication and therapy, as far as research goes too, is the best combination for reducing symptoms as it goes. Whether that's through skills training or through a professional counselor, anything like that, it's really effective when it comes to managing symptoms. So another thing we also need to talk about too is a schizoaffective disorder.
And what is schizoaffective disorder as you best understand it?
Okay, so schizoaffective also sounds incredibly intimidating. And something like,
whoa,
you don't want that.
Yeah.
But at the end of the day, it's not too complicated. It doesn't mean it's not manageable. But schizoaffective is schizophrenia, so like we talked about, with delusions and hallucinations, paranoia. And then also a mood disorder. So generally categorized by manic or depressive. So people that are experiencing hallucinations, delusions, as well as going through manic and depressive episodes, where they may have symptoms in those two phases.
And so I always understood it as just kind of it's the supreme diagnosis. It's got a little bit of everything.
Yeah.
And also too, on different days you may be experiencing different symptoms, but that's also the mood and the psychosis together. And so both of those have to be treated. And again, just kind of knowing, that's the first thing really, is kind of knowing what a person's diagnosis is and really what the best course of treatment is for that individual.
Yeah. And because some of these mental illnesses, they can be debilitating. And by equipping yourself with the knowledge that you have about the illness, about how you can cope with it, and what medications help you the best, that's going to give you the best possible outcome when it comes to recovery or just treatment in general.
I also think too, the clients that we work with, I mean, they're our best educators too. And so, you know, there's one thing learning about, you know, psychosis and people that have schizophrenia at school or in an internship, but there's nothing that really takes the place of working with people that have that diagnosis. And so they're really our best teachers in that regard, and they teach us how to work with them.
Exactly, because no two consumer is the same when it comes to this diagnosis or any diagnosis. And as providers, you know, we have to learn from them to be like, okay, I've used this with somebody else, but I don't know if it's going to work with you right now. I don't know if that's something that you're going to be receptive to, and maybe they won't be. And so you do kind of learn how to kind of help everybody and tailor their recovery to their needs and see what works best for them. Because sometimes you teaching a regular coping skill about breathing techniques or relaxation techniques, but that's something that may give them anxiety, which may enhance other symptoms too. And so you have to focus on something else to kind of, you know, best help them in the best possible way. You know?
And so as a provider and working at our agency, what's a great benefit for you in working with clients that may have a diagnosis of schizophrenia? I mean, what have you learned?
I've learned that a lot of times, especially people in my division working at in the criminal justice system, some of these people haven't had the greatest lives, yet they still thrive. You know, despite a lot of times, substance use, chronic mental health issues, criminal justice issues, trauma especially too. That these people can still recover. I mean, it's not the end of the world, and the right support, such as case management, groups, therapy, whatever that is for them, really helps them, I mean, stay on the right track and motivate them and empower them to be successful. And I think that's always cool from my perspective, because I've had it easier growing up than them, you know, and to see them kind of work through so much adversity and build resilience and overcome their challenges, I mean, it's humbling to the core, you know.
So there's hope in recovery.
There always is hope in recovery. And I think that anybody that's in recovery right now, you know, should stick with their support system, stay in treatment, and do what they have to do, because at the end of the day, recovery is ongoing. And COVID, I mean, whatever it is that's going on in the world, I mean, it's going to get in the way. And so you have to continue doing recovery and doing what you need to do to stay in it.
And I think that's true for all of us. I mean, we don't do any of this by ourselves. And so if people will just kind of stick with us, we're going to find out, you know, what works best for them. Absolutely. And, you know, how best we can help them as providers.
Yeah, I agree.
All right, that's excellent information, Taylor. Thank you so much.
Thank you.
Texas Panhandle Centers, our crisis hotline number, 806-359-6699. Thanks for tuning in.